the reason we decided to do hybrid was because I didn't have enough tissue to make me feel like I wanted to feel. I wanted to at least have the same size breast that I had before. And so he said, yeah, I can get you maybe 60% of the way, but we have this other option. And I said, I don't know if I want implants. I heard that's bad after radiation. He said, just straight on implants put in, your skin can change and things like that. So it's not the best option. But this way, when they do the hybrid flap, the implant tuck so far down in there, you don't even feel them. I don't even know that I have that. With the fat tissue that's there, it feels like my regular breasts again.
So
So
happy to hear that. That's a great story that,
yeah,
that really worked well for you. And it sounds like you had some really advanced doctors. I mean,
yeah,
that's the one thing I really stress is, I was not offered any of the deep flap hybrid, I didn't know anything. I didn't even know like aesthetic flap closure was an option. It was
yeah,
just whatever. So it's really nice to hear that you had that kind of treatment
yeah,
and advancement and that you're happy and
yeah.
all of that. I have a question for you. What did they biopsy? Just your skin?
No, they did a 1 inch incision on the side of my breast, and they went in fairly deep and took out tissue sample. So it was from the skin in, I think, an inch or 2 inches they went in. And now that is not necessarily typically how IBC is diagnosed. IBC can be diagnosed with a mammogram because it does show up on a breast mammogram.
Right.
Um, they can see the webbing of the cancer, the
Okay.
they do call a tumor on there. They can see the webbing of it on an MRI. And they will also do a lot of times just a punch biopsy.
Mhm.
But because my doctor wanted to get this done fast, she just said, I'm just going in there and I'm taking a sample out that I know that they can read and we'll do it fast. Cause I mean, they did it the same day. They read it right there at the hospital. So there
I
was
mean,
no wait.
I think time is of the essence with
Hmm.
these types of symptoms. And so we
Yeah.
did Instagram live with another survivor who had
Hmm.
the enlargement of her breasts, so really seeing the extreme difference and being aware. And I think anyone
Right.
who's listening to this really, and don't be afraid to push because we both
Hmm.
know there's a lot of survivors all over social media that have been dismissed. And thank
Yes.
God, thank goodness you were not dismissed, Katrina,
I that absolutely. And I'm in a location where I have really great doctors, and I have my oncologist is one of the top oncologists in the state. I
wow.
mean, he's absolutely amazing. And, I've been really fortunate, really blessed to be able to have such great medical care here.
Wonderful. I mean, I think the biggest issue that I see between inflammatory and Paget's disease is that it's just very unheard of, not talked about. Now, we
Hmm.
do have people that show a picture of an orange, like it could look like this and all of that.
Yeah.
But to your story, that was not your symptom, and that we need to make people realize your
Hmm.
initial aha moment was a hardening.
Right, right. And it was definitely up where the tail of the breast tissue goes, up by your underarm. And it scared me because, like I said, the soap popped out of my hand. That's how hard it was. And I'm not just talking about like it feels a little tender. I mean, it was like brick in there. It was rock hard. So, and that was essentially within probably a couple of days that it must have gotten like that because I hadn't noticed it the day before, you
Okay,
know.
okay.
So
That's
it
important.
comes on pretty quick. And you know, it was over the course of those 2 weeks after I felt that and I was waiting for that mammogram, um, like I said, I noticed that my breast was starting to get larger on that side, and then it was getting pink, so those symptoms
Not
were coming pretty quick.
Right. Okay.
It was probably about 3 weeks or so after that that I started treatment, and by that time, it looked like a tomato. So, yeah, it was it moves really fast, and it's I don't say that to scare people,
Okay.
um, that anytime your breast is red, don't be scared and think, "I have inflammatory breast cancer," because there are a lot of things it could be.
Yes.
However, you want to make sure that that is ruled out because of
Yes.
all things you don't want it to be, that is the one thing, and, um, like, I remember saying to my husband at the time, when I had seen that video about inflammatory breast cancer years before, I said, "Did you know that there's this other kind of breast cancer?" And of course, he's like, "How would I know?" But
I
I
had
I
no
said,
idea.
kind is called inflammatory breast cancer, and I was like, it's really bad, and it's not a tumor, and all of that stuff, and it's like that's the one that ended up coming for me. So I mean, I just wish more people talked about it so that more women knew about it. But I think now with social media, we have the ability to put this out there so more people can be aware of all of these different things.
So with I just want to go back to I had a question about people, really making sure people recognize that when we did a live with Dr. Stacy Smith Foley, and she said that some doctors are not even aware. I think we need to touch on this because that breaks my heart that the guy, I have a big problem with the gynecologist saying, because I think I have my
Yeah,
own story. I don't think we're empowered. I don't think
yeah,
they have time to say, look, there are other types of breast cancers. And
hmm
maybe you check in the blind spot areas, under here and back, all this. None of this breast health education is
yeah,
out there. That is why I started this. I could
right,
not believe. And so the
hmm
more I meet people like you and Xandra, who has pageants and got dismissed for 18 months because they thought it was a skin rash,
right,
we are the ones that having these open dialogues to get this out there, right, Katrina? So
yeah,
anyone watching, please know that, at least Katrina, if you hadn't seen that video, that's where I'm really like, there was a reason. I mean, what are the
yeah,
chances? Think about that for a second.
yeah.
Yeah,
I
very,
know. I thought about that. Like, that's why it was in my mind. And of all the different types of breast cancer, that's the one I knew about. And so when it hit, it was like,
you had some
okay,
knowledge.
let's
Yeah.
go, you know?
Yeah, and you took action. I'll be honest, I did this. My friends were kind of blown away. They're like, "Look at you! You're lining up your radiation and your surgery. And what's you supposed to do?
Yeah,
This is serious. The word cancer is something we never want to hear, and we
right.
take action. And I think you said something earlier. Moving through it, and just processing it. I think from the emotional side, I
Yeah,
like to bring it to the forefront. Anyone that's newly diagnosed and in such a fear state,
yeah,
one thing that helped me, and I don't know if you went through this, Katrina, is I really dropped down to my knees with the
hmm
mortality head on. And,
yeah,
I went there, I think anyone but I will tell you, based on listening to you, and there are a lot of great treatments and a lot of great doctors, and breast cancer is getting a lot of attention and research. But what we're
hmm
trying to do here is get the education on the forefront because
right,
we all think we're not going to get diagnosed, especially if you have no family history. But
right.
to 85%, which is just mind blowing to me, of
Yeah.
women diagnosed have no family history.